For international patients, it can be difficult sometimes to find a fully matched donor. We do searches of donor registries all around the world when patients are referred to us for stem cell transplant. But for some patients, it can be difficult to find a fully matched donor, and particularly for non-Caucasian populations from ethnic minorities, it can be more difficult to find a fully matched donor. We do a lot of alternative donor transplants at the Royal Marsden, so we can use donors that are either a fully matched donor, that might be a sibling, or an unrelated donor from donor registries around the world. But for patients without a fully matched donor, then we would be looking at alternative donors. And that's predominantly either a donor called a haploidentical donor, which is someone who's a half genetic match for the patient. That might be a sibling or a child or even a parent. But we also do a lot of stem cell transplants using stem cells which are derived from babies' umbilical cords. So for the majority of patients, we can find donors. We've got a number of different ways of finding a great donor for all of our patients. In terms of timing, it depends who the donor is. For someone who's got a fully matched sibling, it can be very quick. We can find that donor within about 4 weeks. But for more complicated donors where there's not a fully matched donor, it can take longer. It can take up to 3 months in some situations. But there's lots of variables that determine how quickly we find a donor, not just finding the donor and their availability, but also the patient and their current treatment, and are they ready to undergo their transplant as well. But we have a whole team of doctors and nurses that are looking precisely at that donor search and finding really good donors for our patients.